Are you losing a little more hair than usual? Noticing that your nails are brittle or peeling? Or maybe your skin is dry or bruising more easily, even though you're really trying to eat well? These changes are often brushed off as stress or aging, but sometimes they're early signals that your body just isn't getting or absorbing what it needs. They often show up long before anything looks abnormal on lab work. I'm Dr. Melissa Blake. I'm a naturopathic doctor on the medical education team at Metagenics. Most people assume nutritional problems only show up on blood work or in extreme deficiency states, but that's actually rarely where it starts. Early changes often show up in tissues that renew quickly. Hair, skin, nails, even our eyes and the lining of our mouth can give us really important clues. And it's not just my clinical intuition. Today, I'm drawing from evidence, including the Lifehouse study, which was a large project led by functional medicine clinicians that examined how patterns on physical exams, body measurements, and biomarkers can reveal early shifts in health. And the goal of this study wasn't to replace lab testing or medical care. It was to help clinicians recognize meaningful signals earlier, before chronic issues become a problem, and to use those patterns to guide more personalized lifestyle and nutritional strategies. So that's exactly the lens we're using today. We're going to use insights from this study, and I'm going to walk you through a practical nutritional exam that you can use at home, not to diagnose yourself, but to become more informed and proactive. As always, a quick disclaimer: this self-exam is for generally healthy adults. It's not diagnostic. Many of the signs that we'll discuss can also be influenced by medications, hormones, medical conditions, genetic factors, and those require proper evaluation. So if you do notice anything, it's new, persistent, or it gets worse over time, please speak with your healthcare provider and consider appropriate testing. Your hair, skin, and nails rely on a steady supply of nutrients to grow and repair. So when the intake is lower than ideal or absorption is impaired because of things like stress or illness, these tissues are often the first to show it. So this does not mean disease. We're not talking about disease today. It might not even be a true deficiency. More often, it reflects insufficiency, which means you're getting enough to get by, but not enough to thrive. So your body is doing exactly what it's designed to do. When resources are limited, it prioritizes survival systems first, like your brain, your heart, your liver, lungs, and nails, hair, and skin. They become lower on the priority list. So what I hope this video does, and what I work with patients to try to achieve, is to become more observant and to listen to your body's whispers. These visible changes are feedback, and catching them early gives you the chance to make small, targeted changes before problems become more complex or harder to reverse. So where do you start, and how do you get the most out of these nutritional exams? We want to think of it as a regular check-in with your body. So it's not a one and done, it's an ongoing habit. So step one is to establish your baseline. Set a few minutes aside for a full head to toe scan. You want to make sure you have good lighting. A full length mirror can be helpful. Before or after a shower works really well. And ideally you're doing this every quarter, like every 3 or 4 months. Set a reminder in your phone, and this becomes a regular wellness routine to help you figure out what normal looks like. And then step 2 is to monitor any changes. So if nothing stands out, stick with these quarterly check-ins. But if something has changed or caught your attention, try to track that weekly for a few weeks. And taking photos and brief notes is surprisingly helpful. Step 3 is to add support as needed. So we always start with food and lifestyle first, and then we layer in targeted supplement support if needed. And ideally we work with a practitioner for extra support. And then step 4 is notice what else matters. Pay attention to patterns. Does your sleep or stress level impact your symptoms? Are you hydrated? Are your hormones fluctuating? And this is really where insights happen. So with that framework, let's start with the most common place people notice changes first, which is hair. Hair is one of the most sensitive indicators of nutrition, stress, and hormones, and it's often the first place people notice a change, or at least a change that they care about. It's super common to see shifts in hair quality or an increase in shedding after major life transitions, things like pregnancy or postpartum, a significant stressor like a change in work, a move, an illness, or a major emotional event. They can all temporarily affect hair growth and quality. That kind of shedding is often part of a normal stress response, and in many cases, it will just resolve on its own over time, but is definitely worth tracking. If you're noticing ongoing thinning, maybe more hair in the shower or when you brush, or a widening in your part, especially if it's outside of a clear life event, that's when hair becomes a really useful clue, and you want to think about protein intake. That's the first place to start when it has something to do with your hair quality and hair loss. So practical tips are to ask yourself, am I eating enough protein at every meal? We want to aim for 25 to 30 grams of protein, especially at breakfast, and ideally with every meal. Do that for 2 or 4 weeks and see if you notice changes. It might also be worth considering a B complex because B vitamins are really important for our overall hair quality. If shedding is an ongoing concern, discuss iron levels and thyroid with your provider. Dry and brittle hair or hair that's prone to breakage often also reflects low protein. It can also indicate inadequate fats or high levels of oxidative stress. So adding fats and protein together, like eggs, salmon, olive oil, nuts and seeds, can be super helpful. Definitely not skipping meals during high stress. And hydration really matters, especially if caffeine intake is high. All of those things can really help with hair structure. Early graying is super interesting. Genetics do play a big role, but it's not the full story. Minerals like copper and selenium are involved in pigment production, so starting there is really important. There's also some really interesting new research on chronic emotional stress and the impact it has on our mitochondria, and that actually contributes to early graying. So the first thing we want to do is review our dietary sources of minerals and consider a multi-mineral supplement to fill and optimize our gaps. And then we want to prioritize stress regulation. We don't just want to supplement, but think long-term sleep quality, recovery, nervous system support. They really matter here. The second section is skin. So now we're going to move to really look at your overall skin head to toe. And this is really a place where we see nutrients playing a huge role. But the first sign to look at is how well moisturized your skin appears. And one of the most common contributors to dry, flaky skin that I see in clinic is poor hydration. And what a simple fix, right? A way to monitor hydration at home is to pay attention to the color and odor of your urine. So pale yellow, almost clear, and a relatively mild odor is a good sign. Anything dark or strong odor means you're probably not getting enough water. Beyond hydration, dry or flaky skin can also be linked to a low intake of essential fats. These are really important for helping to maintain the skin's protective barrier. So including omega-rich fats as a consistent part of your day, not just, the once a week fish meal. Really try to get olive oil, avocado, nuts, seeds, and any kind of fish in your diet on a regular basis. And be mindful of fat intake when you're cutting calories. So I see this a lot when people are dieting, they tend to undereat fats, and that can be a really common reason why your skin becomes dry or irritated. If dryness persists, even though you're drinking lots of water and you've increased your fat, consider whether digestion is part of the picture. So considering maybe a probiotic or a digestive enzyme, maybe something with bile, which helps us digest and absorb our fat, might be something to consider. If healing and bruising are a concern, vitamin C is something you want to look at. It's important for collagen formation, and zinc is also essential to tissue repair. So when you have cuts that are slow to close, or you're noticing bruising more easily than you should, both of those things might be insufficient and are worth taking a look at. So again, practical steps, we use food first. We want to make sure we're getting lots of fruits and vegetables for our vitamin C, and things like seafood, meat, and pumpkin seeds are a good source of zinc. And then also consider a good quality multivitamin. If bruising is frequent or unexplained and also associated with maybe fatigue, definitely talk to your clinician about checking CBC and ferritin to see if your iron is an issue. Now let's move on to nails. Nails reflect weeks or months of nutrition, so they're a really cool area to look at. Brittle, soft nails are often low protein, low iron or zinc. So practical tips are, again, track your protein. There's a theme here. This should be over days and weeks and months, right? And that can really take time. So you want to make sure that you're not just giving it a day or two and then moving on. White dots on your nails can be most commonly a sign of minor trauma, but consistently zinc status is worth exploring. So you want to notice the frequency and pattern of that and not just one nail, and then pair zinc-rich foods with adequate protein to ensure that you're kind of covering your bases. If you're experiencing vertical ridges, these are super common with aging. They're almost like nail wrinkles. But when they're pronounced or paired with slow growth or easy breakage, consider hydration and protein. These are kind of your first stop. And then B vitamins and iron are also often associated with nail health, especially those vertical ridges. And again, any change you make for your nails, give it a few weeks before reassessing. So let's move on to mucous membranes. These are tissues that we can see around our eyes and in our mouth. These tissues turn over quickly and they're easy to overlook but provide really important clues. So if you're experiencing very dry eyes, or it might even show up as poor night vision, definitely consider assessing your vitamin A intake and also essential fats. Cracked lips, especially the ones like when you get the cracks in the corners, that can be linked to low B vitamins and sometimes indicates iron deficiency as well. If when you brush your teeth, you find that your gums will bleed easily, think vitamin C and also just overall gum health. That's definitely worth seeing your dentist for. And then tongue changes, especially sort of like a swollen tongue or a painful tongue, we want to think B vitamins and folate. The Lifehouse study found that a tongue coating, like a thicker orange, yellow tongue coating, was associated with food sensitivities, especially if digestive symptoms were present. So practical tips when it comes to your mouth and your eyes is pair oral signs with digestive symptoms. These patterns matter. If you're noticing things in your mouth and your gut is off, then definitely that deserves attention from a professional. So why do these gaps happen, especially if you're eating well? Even when your diet seems balanced, it's almost impossible not to have nutrient shortfalls. They occur because we don't have perfect digestion. So low stomach acid, gut inflammation, these are things that can interfere with our ability to break food down and absorb the nutrients that we're ingesting. Chronic stress increases nutrient turnover. We burn up things more fast. Restrictive diets or food intolerances, things like being vegan or vegetarian, there's limitations to your nutrient intake. Medications and age-related decreases definitely impact our uptake and intake of nutrients. So here's how to respond. The first thing is I'm a huge fan of tracking food intake. And I know a lot of people are hesitant to do this and find it tedious, but this does not have to be a forever habit. Tracking food for even 5 to 7 days can be a really great way to notice patterns and identify gaps that are happening that you don't even realize, especially in your micronutrients like calcium and iron and vitamin C, as well as your macronutrients like fiber and protein. It's human nature to overestimate all the good things we're doing and underestimate the less helpful things. So most people that I talk to think they are definitely getting adequate amounts of the basics like fiber and protein and vitamin C and calcium, but when they track, they're super surprised that that is not the case. The good news is that there are a variety of free apps to help with this. And once you get an idea of what the gaps are that are showing up consistently, it's not just a 1-day snapshot, right? That's why we do it over several days to get sort of the pattern. Once you know what your consistent gaps are, then you can adjust your diet and create a supplement plan that is more likely to target what your needs are. The second thing we want to do is support our digestion and absorption. So that might be with digestive enzymes to help support food breakdown. Not everyone needs them, but it might be a good thing to consider if you're noticing nutritional deficiencies and also experiencing GI issues. We want to track these things, right? We don't want to just try and then forget or do it once and let it go. We want to make sure that we're tracking improvements and following up with a professional if we don't see change. Your hair, skin, and nails are way more than cosmetic, right? They're windows into your internal nutrition, which is super exciting and valuable. So paying attention to these small changes can help you catch nutrient gaps early so that you can support your health proactively. It's amazing. If you found this helpful, please like the video and subscribe for more evidence-aware wellness guidance. Thank you for spending this time with me. I'm Dr. Melissa Blake, reminding you that small, consistent choices really do add up. See you in the next video.